Hello, everyone. Before I begin, I would like to acknowledge that we are gathered on the traditional territory of the Haudenosaunee and Anishinaabe people. Welcome. My name is Shafqat Ali. I'm the Member of Parliament for Brampton Centre. I'm pleased to be with you on this important announcement, which will provide enhanced Canada-wide coverage and improved access to suicide prevention sports for those in need, no matter where and when they seek assistance. I'd like to also extend a big thanks to South Asian Canadian Health and Social Services for hosting us today. This organization plays a pivotal role in the community by providing culturally sensitive healthcare and social services to diverse communities and by supporting individuals in areas such as mental health, addictions, domestic violence, food bank, and other related programs. Through culturally sensitive counseling, groups, and awareness campaigns, they actively work to diminish the stigma associated with mental health in South Asian cultures. By fostering an open dialogue, these services contribute to more inclusive mental health landscapes as they have done in Brampton and across Canada. The organization's commitment to collaboration with local agencies ensures a comprehensive approach, bridging the gap between the South Asian communities and the broader mental health support system in the country. In doing so, South Asian Canadians' health and social services not only meet the unique mental health needs of the South Asian population, but also contributes to the overall diversity and inclusivity of Canada's mental health initiative. Finally, I'm pleased to welcome my colleague, a hardworking minister, the Honorable Yara Sasks, Minister of Health, Mental Health and Addiction, and Associate Minister of Health to our community for a very important announcement to support the mental health of Canadians. So without further ado, I would like to invite my friend, my colleague, and hardworking minister, Yara Sachs. Please come.
Hi. Okay, you got it?
I'll just keep it.
Yeah, perfect. Okay. Hi, everyone. Good afternoon. Thank you, Shafqat. It is so wonderful to be here with you in Brampton Centre. Bonjour à toutes et à tous. Hello, good afternoon. Salam alaikum and namaste also. I'd also like to take a moment to acknowledge where we are. Just a moment to say that we are gathered on the unceded traditional territory of the Haudenosaunee and Anishinaabe people. We are humbled to share these sacred lands, to play, live, enjoy, grow, and foster our lives on these lands with our First Nations peoples who have lived here and stewarded this land for thousands of years. And for that, we are so, so grateful. It's such a pleasure to be here with the South Asian Canadians Health and Social Services Group and to share this exciting announcement with you today. Since 2010, your incredible team has provided healthcare and social services to South Asian and other communities here in Brampton. Thank you always, sincerely thank you always, for being there and supporting people in your community when they need it most. From a distress line for those in crisis to counseling, mental health support, health promotion, community outreach, and so much more, you are such a critical resource to this community and to many other communities across the city, if I might add. Yes, that deserves a round of applause, absolutely. Your services are essential, especially for those who have nowhere else to turn for help. Because if we're honest, right now Canadians need our help. We're facing a severe mental health crisis. Suicide is a leading cause of premature death in our country. Every year, approximately 4,500 people in Canada die by suicide. And if you think about that for a moment, it's 12 people each and every day. That's 12 people too many, because it's a horrific tragedy. And we know this because every person lost to suicide leaves behind a grief-stricken family, friends, loved ones, and colleagues who struggle to pick up the pieces from that loss. And while suicide can affect anyone, we know that some in our community are at greater risk. This includes Indigenous peoples, youth, men and boys, older adults, members of the 2S LGBTQI+ communities, as well as people who live in rural and remote communities. And we need to continue to take concrete steps to provide people across Canada with the best possible mental health and crisis intervention supports and resources, because we know this is how we are going to save lives. For someone who is at their lowest point, a caring voice on the other end of the phone can be that lifeline. But we also know that not everyone needs the same kind of help delivered in the same way. There are so many factors that impact someone's mental health and the support that they need, whether it's unemployment, poverty, food insecurity, or social exclusion. As a mother of 2 young daughters, I worry about our young people, because a young person in crisis, for example, may face very different challenges than a senior with chronic health problems. And distress centers and crisis lines are best placed to respond to the different needs of those who come to them for help. All of you in this room are the experts. You know your communities and the unique needs that they have. And these differences matter. Knowing your communities matters, particularly when it comes to helping someone in crisis. That's why on November 30th, Canada is introducing the 988 Suicide Crisis Helpline, a new 3-digit number for suicide prevention support. The 988 initiative is led by the Centre for Addiction and Mental Health. It will be available in English and French, by phone and by text, 24 hours a day, 7 days a week. And I want to take a moment to thank the CAMH team who are here today for everything that you have done to get us to this point. We could not have done this without you. I'm really so glad you've been able to join us today for this exciting announcement. So now the news. Today, in the lead up to our big launch on November 30th, I am proud to announce that South Asian Canadians Health and Social Services is joining the 988 network to provide local support to people in crisis right here in Brampton. Thank you. And I'll explain for just a moment why this is so important and how the team here in Brampton will be a critical part of our 988 work and the network. With 988, we are building on the current Talk Suicide Canada model, which connects existing crisis lines from across the country into one responder network. When someone reaches out to 988, whenever possible, they will be connected to the responder who is closest to them based on their area code. What this means is that trained crisis responders from South Asian Canadians Health and Social Services will be connected to callers who dial 988 in the Brampton area. Additional capacity will be available through the 988 network, including through a robust national hub. When a local responder is not available, there will be someone else on the line, because everyone who answers a 988 call or text will be trained in suicide prevention. We want to make sure that no one in a moment of crisis is left behind. And we did this to ensure that if you need support from 988, you will be connected to someone in your community who will better understand your needs. By building on these existing partnerships, we can ensure that the best possible services are in place for people in need and that we love. In the coming weeks, we'll be announcing more agreements like this, so stay tuned, because all of this is fantastic news, because it means that we will have a 988 that will have enhanced Canada-wide coverage, but it will also be diverse and inclusive and ensure that suicide prevention support for people in need, no matter where they live or when they call, will be answered. As Canada's Minister of Mental Health and Addictions, I am so proud to work hand in hand with organizations like the South Asian Canadians Health and Social Services, who show up each and every day to support Canadians. Because when it comes to mental health, we cannot work in isolation. We can provide much better access and services when we work together. Diversity is indeed our strength. That is why I'm confident that 988 Suicide Crisis Helpline will be a success because of people like you. And we know that Canadians need this service right now. In my short time in this role, I've gotten to visit crisis centers and seen their work up close. I've heard so many stories of Canadians who sought mental health support from crisis centers, and their lives have been changed for the better because of it. You are often the first point of contact for people who are struggling. You see them, you hold them up, and you carry them forward. And that's why you are an essential part of Canada's public health approach to suicide prevention. I want to thank South Asian Canadians Health and Social Services and all of the current and future partners of the 988 network for the invaluable services that you provide and your dedication and your very hard work. And finally, I want everyone to know that if you are struggling, you are not alone. There is help available. 988 may be launching on November 30th, but until then, Talk Suicide can be reached at 1-833-456-4566 by phone and by text in the evenings, and also at 45645. If you are a resident of Quebec, you can call 1-866-277-3553 or text 5-3, 5-3, 5-3, or visit suicide.ca for support by online chat. We have many different ways to reach you and for you to reach us. There is help on the other end of the line. Thank you again for having me. Together, I'm committed, and I know we will, build a safer, healthier, and more caring future for all Canadians, one where we see one another in crisis and also have the opportunity to embrace one another in healing. Thank you.
Thank you so much, Minister, for an amazing announcement, and congratulations to the organization for being chosen to be added in 988. Now, I'd like to call Dr. Allison Crawford, psychiatrist and Chief Medical Officer, 988 and Talk Suicide Canada. So please come and say a few remarks.
Thank you so much, MP.
Thank you, Doctor.
Thank you. Good afternoon. It's more than a good afternoon. It's a really good afternoon, and it's so good to be here. I want to thank Minister SACHSS and MP Ali also for being here today for this important announcement. And thank you to Dr. Maher Hussain and Abu Becker for hosting us. I also have a number of colleagues that join me today from CAMH, and they, along with a very dedicated team, are working hard towards the launch of 988 at the end of this month. We really wouldn't be where we are today without their leadership and without all of the partners who've joined us. So I've been a psychiatrist for almost 20 years. Throughout my career, I've had the opportunity to witness the life-saving power of connection. Health really happens between people. By being there, by listening, talking, lending support, I've had the privilege of accompanying patients as they find their way through struggles with suicide and also the loss of hope. But I've also seen firsthand how even one conversation can help someone reconnect with their own strengths, to forge new ways of coping and to find new sources of hope. A sense of connection and belonging is literally life-saving. That's why I'm so proud that CAMH, along with a network of partners funded by the federal government, are launching Canada's 988 Suicide Crisis Helpline at the end of this month. What sets 988 apart from existing suicide prevention helplines is its simplicity. 3 easy to remember numbers. In a crisis, looking for a 10-digit number can be a barrier that doesn't need to exist. Over the past year, the team at CAMH has worked hard to bring 988 to everyone in Canada. We've worked closely with a growing network of more than 40 experienced local and national crisis line providers across the country who will answer calls and texts and provide culturally appropriate life-saving supports to people in the time of their greatest need. Support close to home is one of the key values that underpin 988, and partners are going to play a critical role in providing that service locally. Because of them, people who reach out to 988 will be able to connect to a responder who understands the issues that are impacting their lives. These are partners like South Asian Canadians Health and Social Services, who are already engaged in the important work of suicide prevention. Efforts that recognize the unique strengths and meet the needs of the communities that they serve. Minister Sachs, MP Ali, and the entire federal government, thank you for supporting this life-saving service and for your partnership and collaboration as we get closer to launch. I'm looking forward to continuing to work with you and our network of partners to improve the lives of those who are most in need, so we may work towards a world where everyone believes that life is worth living. Thank you.
Thank you so much, Dr. Crawford and your team. You're working hard in saving lives. It makes a real difference, just one call and one discussion and one conversation. Recently, I came across with one individual where I was able to have that conversation. And I know how important that a conversation is. So thank you. Thank you so much for doing this. Now I'd like to call Dr. Dr. Maher Hussain, the Chief Executive Officer and Clinical Director of South Asian Canadians Health and Social Services. So please come and say a few words.
Good afternoon, everyone. Thanks the Honorable Minister and Honorable MP and dignitaries and professionals and our colleagues. I thank you and welcome all of you for this a great occasion and a great announcement for a great program made by our Minister. So my name is Dr. Maher Hussain, and I am the CEO and Clinical Director for South Asian Canadian Health and Social Services. Now, we provide services in areas of mental health, addiction, and other related services. We do also have a crisis helpline, and we also have a food bank for helping people who are in need of such services. And we do provide group counseling programs, individual counseling programs, and outreach program in the community. And also we do have individual counseling programs, group counseling programs, and outreach programs in the community, in addition to family counseling, couple counseling, youth counseling, and other, and also programs such as anger management, stress management, and programs for domestic violence, PAR program, Partner Assault Response Program, and other similar programs. So this program 988, as a mental health specialist, I know the need for such services is a much needed and much essential services. We are very excited and looking forward to this program. Even though we do have a crisis helpline, we are excited and looking forward to join this program and to do it in a really bigger way and helping a lot of people and members of the community. In addition to services in English, we also do provide services in South Asian languages, including Hindi, Urdu, Punjabi, Tamil, and other South Asian languages. So we are also excited and looking forward to provide services, culturally and linguistically appropriate services, the services much needed by the community here. As you know, as you all know, GTA, Brampton, Peel region, they all have a fast growing, huge South Asian population. And so there is a real need for services in their own languages also, which we'll be very happy to provide, in addition to provide services in English. And one of our team members, she speaks French also, so she'll be providing services in French as well. So I thank you once again for all who are here for this grand, much needed and much required services, and for this grand occasion. And also we thank very much the Minister, MP, and also the Government of Canada and Public Health Agency of Canada for providing us an opportunity to get to be a part of this program. And also we thank very much CAMH to be the lead organization who is leading us through this project. We are very happy to work together with you and provide our own services under your leadership of your leadership, under the leadership of the Government of Canada and the Health Minister. Thank you very much, sir.
Thank you, Dr. Maher. Now I'd like to call upon Dr. Abu Becker, President, Board of Director, South Asian Canadian Health and Social Services. So please come and say a few words. Thank you.
Good afternoon, bonjour, assalamu alaikum, sastrikal, vanakkam, namaskaram. This is the South Asian Canadian Health and Social Services. What a delight to be welcoming you each and everyone to our beautiful city, Brampton. Thank you to our Minister, SACHSS. And look at her name itself, SACHSS and SACHSS. It's correlated very nicely, it sounds good, right? That's the beauty of it. So this program is going to be one of the best successful program across Canada. I want to thank Almighty, and also I want to thank our Honorable Prime Minister Justin Trudeau running the beautiful caucus to bringing such a need of the hour program for this everyone. And also our brother Shafqat Ali with us for delighting us. And I want to CMH for the supporting this for years actually. So I wanted to, entire team is here. I can see the volunteers, the feature. So everything started with the feature of investing in the youth and all. We have all the people. And plus our board of directors. We are, maybe you say doctor, I'm not a doctor, okay? Just kidding. But anyway, after working with everybody, you feel like you are a doctor. Because why? Sometimes what a doctor work professionally, but we have to hear more about the patients, the needs, whatnot. So you always feel like a doctor. Thank you very much for that. I wanted to, honor our the board of directors. Everyone's here. We are a volunteer associations. We are all volunteers, father, brother, friend, as a Canadian citizen. Canada is one of the beautiful countries on the planet. Any country, like we are rich in everything. God bless our country. It will keep blessing. One of the happiest people, one of the honest, and one of the purest people. Whenever there's a problem, we open our heart. That's what we are so blessed and happiness. But when people come to this country, we are immigration country. It's totally a different world. First of all, culture shock, language barriers, then day-to-day survival of the life. When I moved to this country 23 years back, you know that everything what it is. But we need help. When he said, anywhere, any religion, anything you go, love. Love is the key actually. Even you talk to somebody with the love, even one smile, when you look the eyes, even it start from the home actually, with the family. That's what the kids going to do. Because why? We are busy life, we do work, we run around, we are with gadgets, so much thing there. But we have to start from the family. As a SACHSS, we do our best because we have doctors, volunteers, everything. So Dr. Maher already mentioned all the service. I'm not going to repeat it. I wanted to thank entire team selecting us as a partner to work with us. So we assure you, this will be delivered to each and every one because we are a Canadian, we are a South Asian Canadian, we have all the platform tools because we started this organization 2010, 13, 14 years. Even some of the, our CEO, our volunteers working on the COVID time, the crisis, everything was closed. We were conducting a webinar, seminars, Zoom call, unbelievably. And also this program, SACHSS, is supported by federal government, provincial government, as well as the local city government. The partners make sense. I want once again thank each and everyone. May God bless you each and everyone, and hope we can save the life through nice talk to them. This 988, it's going to make a big changes for each and everyone. God bless Canada. Thank you so much.
Thank you, Abu Becker. That concludes our program. Now I'll pass it on to moderator. If anyone has any question, we're happy to take it. One question, one follow-up.
Okay, thank you. So we'll begin the Q&A with any questions from the media here in the room. Merci. Nous commençons la période de questions et réponses avec les médias ici dans la salle. So we do have a question, I believe. Please use this microphone and state your name, media outlet, and who your question is directed to. You may ask one question and one follow-up. Il y a une question. Veuillez utiliser ce micro et indiquer votre nom, votre média et le destinataire de votre question. Vous pouvez poser une question avec un suivi.
Hello, Brand Rowe with City News. I guess this is kind of open to anyone. This was talked about at the beginning about how that there is a stigma when it comes to talking about mental health, especially in BIPOC communities. So what are you guys doing to ensure and to make sure that people are actually using the service?
Thank you for the question. So I think an announcement like we made today is exactly what we're doing to address BIPOC communities across the country. We know that we have to ensure that the network of services that we provide are meeting Canadians where they're at in the communities that they live in, but also with service delivery that is culturally and linguistically appropriate and that makes sense, so that there's a sense of safety and trust when someone is in a time of crisis. They need to be able to forge those connections that Dr. Crawford spoke about, which are rooted in trust, and trust comes from those who know you and see you. So as we continue to make announcements about the growth of the network over the next few weeks of 988, there's a significant amount of investment in ensuring that we are meeting all our diverse communities across the country.
I don't know if maybe the reps from CAMH can speak to this, but just if you can kind of explain, for people that have never used a hotline like this, how beneficial they are for people that are in crisis.
Come on up.
Thank you for your question. Yeah, we know from this is an evidence-based service, and we know from the evidence that being able to reach out and connect to someone on a crisis line for support reduces distress, and that people in significant need use the crisis line. So we know that it's a very valuable resource. Responders are trained is the other important thing. So these responders will be working across the country, but callers and texters will get the responder closest to their home. But all of those responders will be trained to provide this life-saving service and really to make a connection with people. We also know, just to echo some of the points that Minister SACHSS made, we want to create an inclusive space. So each responder is trained to meet people's needs in a culturally safe and responsive way.
Sorry, I just have one more from the South Asian Canadian Health and Social Services. You guys are obviously on the ground. You're within the community. You're speaking to residents here. What have you seen? Why partnering with the government to put together this crisis hotline? What have you guys seen that to note that this is something that is needed here?
Yes, thanks for your question. So we do have a crisis line, but this does not cater to everyone, and we do not have enough resources to cater to everyone and to meet all our needs. This 988 program, it's a very huge, ambitious, and really a great program which covers a whole of Canada. Like as Honorable Minister said. It's a very easy, simple number to remember. When people are in crisis, it's difficult for them to search for the 10-digit number to call someone. So it's everyone like 911, it will be like fingertips with everyone. And also a lot of huge amount of resources available. We are confident of meeting all our demands and all our calls because we are going to have a huge network with different partners covering all over Canada. And also, like our minister said, the calls will first will go to the local network, local people who can address these issues and talk to them in their own culture and language and provide both the culturally and linguistically appropriate languages as well. They'll be more tuned to the local culture and language as well. But this model is going to be applied to all over Canada. That's a very huge thing, and that's all going to be possible by the help of the Government of Canada, Public Health Agency of Canada, CAMH, and agencies like us. Thank you.
Okay, thank you, merci.
So it's a great questions. So very important is the communications. When I said love, start with communication. Somebody understand the people in stress or mental health issue. The first thing is the communication. So that way start with language. So we feel, because we've gone through 13 years of treating clients, either it's a senior, either it's a mother, either it's a newcomer, whatever that thing. Once you talk to them in the culture barrier, it's breaking up. So once they understand the comfortable of, oh, somebody's there for me, that's what the love comes. So once they have it, then the treatment, then things will get better. So as a South Asian, we have right now, we speak about 15 languages. We can open to everybody, of course, English, then French. We have all other South Asian language mostly, because it's all volunteer-run organizations. So definitely we can open the door. It will be a great asset, and also with government support. Together we can work, we can make a difference in life. One soul at a time. Thank you.
Thank you, merci. We'll pass it now to the Zoom for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Thank you very much. If you are a reporter on Zoom and wish to ask a question, please use the hand raising function. Unless I've stated it, please indicate your name and media outlet before posing your question. Si vous êtes journaliste et vous désirez poser une question sur Zoom, veuillez utiliser l'option de lever la main. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. I don't see any questions on Zoom, so this will conclude our event. Il n'y a pas de questions, donc l'événement est maintenant terminé. Merci beaucoup.
So that's end of today's event, and thank you so much for everyone coming out, and then our media personnel as well. And special thanks to our minister coming all the way from Ottawa in Brampton for making this important announcement. Thank you so much.
Recording stopped.
There are refreshments available. Please, all of you help yourself.